This is one of the products we use for the internal bra technique to maintain breast shape, breast form, prevent recurrent ptosis, which is repeat sagging of the breast. This is trade name Galaflex. It's P4HB. It's an absorbable material, very much like suture, that stays in the body from anywhere from 1 year to 2 years before it resorbs. And what it does is it actually creates a layer of scar tissue to enhance and create soft tissue support in the area that we need soft tissue support. So the question always gets asked, when do we use this product? Why do we use this product? Well, oftentimes, patients' tissues and their tissue quality leads us to believe that they're going to have recurrent ptosis. And so this is a great product to be able to place within the breast, give us that tissue support that we need to prevent that recurrent ptosis, i.e. to give them a longer term result. So we use this quite frequently. Another arena that here at HKB that we utilize this product a lot is people who have malposition their implants. And we often get asked, what is malposition? What's that? Where that implant is not in the right position that it ultimately needs to be. For instance, a lot of times, after patients have had implants for an extended period of time, that implant kind of slides off their chest wall and it lies within their armpit. And so when we go back in to repair that, exchange that implant, there's numerous techniques that we do to kind of reinforce that and move that implant back into the position that it needs to be in. And we do this all internally without external scars. You can actually use this product for reinforcement inside the breast pocket to give you that extra support. And a lot of doctors, and we use this terminology a lot, it's more like an insurance policy for your results, right? And in essence, you can place this within kind of your mastopexy, which is a breast lift, or within your pocket of doing an implant to give yourself insurance that these results are going to last significantly longer and you're going to have the look that you want for much, much, much longer. I often get asked, is this product safe? Yeah, it is, because it's made of the same material that your sutures are made of. And we've been using sutures like this for an extended period of time. We've been utilizing this in the breast for multiple years now. Both Dr. Bahardi and myself, we actually speak on this nationally. We've talked about this product. We speak at the national meeting, kind of highlighting our results and our technique of how we utilize this within our breast patient population. Extremely safe. And like I said, it's resorbable, so it goes away. It just is there long enough to give you that extra support while the breast is healing, and then the product ultimately goes away. A lot of patients ask because they don't really want yet another foreign body inside them in addition to the implant, but they find solace in the fact that this is going to end up going away, and it's there just for a short period of time to provide that extra support when it's needed. I often get asked, can this product cause capsular contracture? No, and in essence, we found that actually the placement of this can actually prevent capsular contracture. We're doing a study right now to kind of showcase that. We've used it in the past and had amazing, fantastic results that showcase that, but we're actually doing a multi-site study right now to actually really try to elicit that data to showcase that this can actually prevent capsular contracture. It is a common concern that a lot of patients have is, can it cause it? And right now, based on our experience, it does not. Does this product change your recovery after breast surgery? Not at all. Is surgery longer when you get an internal bra placed? Yes, because we're actually placing, an additional device and that we're doing additional techniques, the procedure can be slightly longer. However, if you go to an experienced surgeon such as ourselves at HKB, this can be done with very minimal extra additional time in the operating room. So again, this can be done effectively, efficiently, in a quick manner to give you longer term results. There are other mesh products out there besides Galaflex or the P4HB. There's a product called Durazorb. There's a product called Tiger Mesh. All of these kind of do very similar things. They're all made of different products. Ideally, in a perfect world, when utilizing these products, you want to utilize something that is resorbable, that's not going to be there long term. The problem with using something that's long term or there's going to be there forever is the fact that sometimes that can create problems and you can potentially feel that device over time. And patients do not want an extra product in there that's going to be in there for forever. So again, use one of these devices or products that's going to provide you soft tissue support that is going to be there in a short amount of time. I often get asked can you use this only in one breast? You can, but in a perfect scenario, we're trying to create symmetry. And what I like to tell patients and other doctors that we teach all the time, if you're going to do something to one side of the breast, you want to do it to the other side. So ultimately, if we're going to do this, you would want to do it on both sides of the breast so that you can retain and make sure you get that outcome that you want for an extended period of time, and it's similar, and that both breasts will age exactly the same way. Patients often ask about pricing. Yes, there is an additional cost for the actual technique itself, an additional cost for the product itself. But again, like I mentioned earlier, it is like an insurance policy. And so I would look at it like that and know that you're actually paying slightly more to maintain your outcome for an extended period of time.